So has COVID exposed China now? Has China's zero COVID policy been completely exposed? Is China guilty of fudging data on COVID? Did India handle the pandemic better? Should the world now worry about new mutants that might be out there? Some of the questions we'll raise with our guests. I'm joined by Dr. Subramanian Swaminathan, Director Infectious Diseases at Gleneagles Global Health City, and Dr. Giridhar Babu, Professor and Head Life Course Epidemiology at the Public Health Foundation of India. Gentlemen, I'll come to you in a moment because with it, I spoke a little earlier to my guests from the United States. I spoke to Dr. Eric Feil-Ding. He's epidemiologist and health economist in Washington, D.C., and he's been raising alarm bells for a while on Twitter about China. Dr. Ding, you've tweeted, hospitals completely overwhelmed in China ever since restrictions dropped. Epidemiologists estimate more than 60% of China, 10% of the Earth's population likely to be infected over the 90 days. Deaths likely in millions, plural. This is just the start. Your tweet has gone viral. Are you being alarmist once again? Or do you think this is a new reality the world must contend with, especially China?
Well, thank you for having me. I want to point out that, when the Delta wave swept through India and when many of the Omicron previous waves swept through Europe and America, most of the people were infected, right? And so affecting 60% of a population, if you don't have restrictions, is very possible, and we've seen it time and time again. And if we know that 800 million people are going to get infected in China, then saying there's like 1 to 2 million deaths is very, very low in proportion. And we can easily see that because China does not have really, really strong vaccines. Its vaccine coverage is very poor in the elderly, especially boosters. And in this day and age, if you don't have boosters, your protection is very low. China does not have many Paxlovid drugs, and in mainland China, the per capita hospital beds and doctors and nurses is much lower than in Hong Kong and other places where once they lifted restrictions, we saw very, very high mortality rates. So there's no reason to think that the same thing won't happen in mainland China. Now, of course, the only thing that could stop that would be if the government reversed its policies and went back into much more strict rules, but I don't see that happening. So I'm worried that, and many epidemiologists are worried that this is easily, you could see millions of deaths and hundreds of millions of infections over the next 90 days.
Are you therefore suggesting that this is primarily because restrictions were lifted as China decided to abandon a zero COVID policy? Are you also suggesting maybe, as some fear, that there could be a new variant that is not just in China, but is also possibly now in other parts of the world, like the US, Japan, South Korea, which are witnessing again a rise in COVID cases?
Yeah, it's a combination. So first of all, variants are emerging at a very rapid pace. Previously we had a new variant every 6 months and then every 3 months. Now we have new variants almost every month. And now we have variants on top of new variants. And China does have variants such as BF7, which is evasive, and also a little bit more severe. The US has BQ variants, BQ1s. But the thing is, when you have a virus go through 800 million people, there's bound to be newer and newer variants. So that's a real concern because each of the variants are becoming more, they're being trained to be more vaccine and previous infection evasive. And that's inherently the problem. And of course, restrictions. China's lifted some restrictions, but not like Western lifting of restrictions. I would say China has lifted about halfway between where it was before and where it is in the West. But it's still, given how evasive and infectious Omicron subvariants are, I think that's the double whammy. Lifting restrictions plus poor past immunity, poor vaccination, and new variants. This just bodes very poorly for China.
You've said doubling time in China may not be days but hours now, quoting some epidemiologists. In India, interestingly, numbers at the moment are at their lowest. Again, I ask you, are you being alarmist when you suggest that China now could simply go out of control?
Well, yeah, the doubling in hours, that was someone else who said it. I think it's possible within certain cities. If you don't have restrictions, that is possible. But we can't know for sure, because I said in my tweet that it's hard to pinpoint that because it's hard to do testing that fast. But I also want to point out, Delta variant, when it hit India, if you remember, and I'm sure you do, in April, May, June of 2021, people who were saying COVID will hit India were not being alarmist. You know, a lot of people who were saying that India will be hit hard, or who would say, oh, India was a herd immunity. But we saw what happened in April, May, June of last year. So we should not be arrogant in that sense, because you know, yes, India has already had an infection wave, but China still has not. Mainland China, if you look at the per capita case rates, are very, very low. And in certain ways that's good, but in certain ways it also makes them vulnerable. So if you don't think that what happened in India could happen again in China, then obviously you can disagree. But we know what happened in India, and I worry for the people of China right now.
So are you saying, therefore, net, this is a problem specific to China at the moment? The rest of the world need not worry at the moment about another surge or another variant out there that could be potentially infectious and fatal?
I wouldn't say need not worry too much. I would say that they won't be hit as hard as China is, because China is almost virgin territory for not having previously been infected, right? India's already had a burn through, because India's burn through, as you know, was very cataclysmic last year. Now, the issue is these variants, like, they cause huge numbers of reinfections. And the question is, of course, how bad will it get? Like in the U.S., we're already seeing hospitalizations rising, deaths rising again, as well as in Europe, hospitalizations and deaths are rising again. Not as bad as before, but they're still rising, especially since we've only started winter. Actually, we haven't even officially started winter yet. So we are still, I think, not in the clear in any ways. It's just China will have a really, really bad burn through that many Western countries saw in spring of 2020. And India saw of spring of 2021.
Okay, let me leave it there, Dr. Ding. What you're saying at the moment is what happened to India last year is what could be happening at the moment in China at the moment. What happened with Delta to India could be happening at the moment with China. Appreciate your joining us. I spoke to him earlier, remember. Let's therefore widen this to the Indian connection. And I want to bring in Dr. Subramanian Swaminathan and Dr. Giridhar Babu. To you, Dr. Giridhar Babu, first, as an epidemiologist, is there any concern that you have that we are seeing a surge in cases in some parts of the world, even though in India, as I repeated earlier, cases are at their lowest? Is there any cause for concern at all? Could we be at half time, to use a football analogy, in the world of COVID?
Yeah, more than the football, I would rather use the cricket terminology. The preparation has been, in terms of the pitch, has been inadequate in China. Their fielding and even in terms, which is the hospitals, has not that been great, because they did not step up the response during the zero COVID strategy. The vaccination rates have been not really great, especially among the elderly. So China is a different example. They did too little, and now they're doing too late in terms of opening up. As a result, it will burn, the infection will spread faster, and therefore what we should be focusing is on, as Dr. Arora rightly pointed earlier on in your discussion, what kind of surveillance strategy we have. Can we pick up if there are new variants? Why I say new variants? As of now, there are no new variants, but whenever you allow a virus to flourish, to circulate faster and circulate among more people, there are more chances for the variations to occur. And it might be not as fast as influenza virus, but it is only a matter of when. It's not a question
so
of...
are you linking, you're saying treat China as an exception, but the rise in cases in some parts of the United States, Japan, other countries in the world, do you see it as a new variant out there, or is it that some countries have let their guard down? How do you see it?
At this time of the year, there concurrently, there are outbreaks happening due to COVID-19. It's also respiratory syncytial virus, RSV, and there's also flu epidemic. So we need to distinguish between what actually is the reason for rise in number of cases in different regions of the world. But yes, wherever the immunity is falling down, wherever the susceptible pools are being created, we will have outbreaks because this virus is not going to disappear just like that.
Okay.
The point for us is in terms of booster coverage, Rajdeep. Now, we have not done really well in terms of booster coverage. So there are only two aspects that we need to do: expand the booster coverage to all the elderly and vulnerable. We already have hybrid immunity, but then we can't take that as a guarantee against any future variants.
Right.
And lastly, as done already, the surveillance strengthening is key. Both outbreak detection and genomic sequencing concurrently are going to be the mirror of where the outbreak will be.
Dr. Swaminathan, would I be right in saying we are in a better place than most parts of the world today as we end 2022, a year that started with Omicron, which fortunately was not fatal in most instances. It was contagious to some extent, but not fatal. Are we in a better place today than most parts of the world?
Probably, but with the caveat that what we don't know is what is really scary. At this point, at least, there are a lot of positives to take away, and a couple of concerns that we have, and maybe areas where we could strengthen and improve. But overall, I would say we are in a much better position than we ever were with regards to COVID pandemic. That is without any doubt.
You're saying we are in a better, we seem to be in a better place. One concern, and I've just got it on WhatsApp from a friend who says, look, there is a concern over long COVID, for example, in India.
Correct.
There is also concern that people who've had the booster, some people have also experienced COVID-like symptoms. Should all of this be of cause of concern? Do we know enough about long COVID? Do we know enough that boosters on their own are enough to ensure that you will not get COVID symptoms?
No, absolutely. See, there are lots of areas within COVID itself which we do not know enough about. For example, all the syndromes that get triggered after COVID, we have seen for all the way from the weird to the wonderful and not so wonderful for the patient, I suppose, being triggered after COVID and lasting for months at this point of time because we don't know how long it will last in the future. There's a lot of data coming out from the West, but unfortunately, the quality of data and the amount of data that's coming from India is fairly sparse, and therefore, people have lost interest in COVID, I suppose. So I think we need to spend a little more time in that and try and understand what the pattern of long COVID is in our country and how best to tackle it, because it may be very similar to what it is in the Western world, or it may be different. We won't know till we start capturing data.
You're saying that we won't know till we capture data, Dr. Swaminathan, but, should we, in a way, pat ourselves on the back, look at where China is today at the end of 2022, that they are struggling with their zero COVID policy, that at a time when we were very critical of our government in the summer of last year, today can the Indian government claim, look, we've done much better than China?
No, I think both polar views are wrong. China moved from one pole to another. I mean, don't say that I call them bipolar. I didn't say anything like that. But these kind of vacillations are actually very, very dangerous. Let's not take any positions that way. I will give you one example of what we could do differently. We are currently doing genome sequencing for positive tests. The problem is people have stopped doing tests. Somebody comes in with a mild respiratory illness. It's not a question of how mild it is for that person. It could be deadly for the next person. So we need to be picking up more. A better way would be to look at wastewater surveillance and doing it regularly to see if there's a spike. Data from many parts of the world have clearly shown that there is a spike in the wastewater before there's a clinical spike. So we should be doing things like that, at least in big centers, to try and see what's happening with regards to numbers. Because we are patting ourselves on the back without actually having real numbers. And like was pointed out, because there is so many other things like influenza and RSV going around, we don't know which respiratory infection is currently the alpha at this point of time. And unless we test, it's difficult. The problem with individual testing is that it's very expensive, cumbersome, and people don't want to hear the word COVID. And wastewater is probably the best alternative that we have. And unfortunately, I have not, although INSACOG has been looking at this, is what I've been told, I have not seen a very good quality data in the public domain with regards to wastewater surveillance and COVID I mean, I'd love to see that. I think that would be a great surrogate marker. That's an example of something we can do differently. Now, as far as China is concerned, we know they have shown that the nasal vaccine is probably likely to be a game changer. They should be going hammer and tongs at it. And I think even our government should be moving very, very fast to look at this nasal vaccine, because it produces much higher levels of neutralizing antibodies and much better respiratory immunity. And we should be moving as fast as possible in that area. I mean, I think Eric Finkelstein also mentioned about that. And I think that's something that we are not paying enough attention to. So like I said, there are some areas where we could probably do better. But overall, I still think we are better than passing.
So therefore, in conclusion, Dr. Giridhar Babu, hospitalizations at an all-time low in India at a time when we are seeing this COVID surge in neighboring China. Dr. Arora at the start of the program said, don't panic, don't be alarmist, holiday season is upon us. I guess there'll be even more travel in the next few weeks. Overall, would you agree with that? That we can now, in a way, return, if I may call it, to completely normal life as we enter a new year?
Yeah, so there are a couple of aspects there. We should not panic. I definitely agree with that. But what we need to be careful is the booster coverage needs to expand. The study from CMC Vellore showed that both Covivax and Covishield as a booster does better, irrespective of which the primary doses are. I think that's the way forward for expanding the booster coverage. That's an essential aspect, and stepping up surveillance. Though we should not panic, we should be proactive. India did really well as a response to the rise in cases in Delta. Now probably China is doing it. Every country is responding after initial setbacks. So we should not have another major wave like the second wave anywhere in the world. For that, we need to step up booster coverage.
Okay, so booster coverage in particular is what you're suggesting. Perhaps testing being much more rigorous is what Dr. Swaminathan also is suggesting. But I appreciate both of you joining us at a time when, as I said, the government of India has called a review meeting to look at existing COVID measures amidst the surge in cases in some parts of the world. Thank you very much for joining us. The return of COVID, will it come back? And hopefully, will it ensure this time that it's under control?